So with that, let me now introduce you to our very special guest presenter, Dr. Leiyu Shi. Dr. Shi is Professor of Health Policy and Health Services Research at the Johns Hopkins University Bloomberg School of Public Health, and he's in the Department of Health Policy and Management. He's also the director of the Johns Hopkins Primary Care Policy Center. He serves as co-editor-in-chief of the International Journal for Equity in Health. Dr. Shi received his doctoral education from the University of California, Berkeley, majoring in health policy and services research. He also holds a master's in business administration focusing on finance. Dr. Shi's research focuses on primary care, community health centers, health disparities, and vulnerable populations. He has conducted extensive studies about the association between primary care and health outcomes, with a particular focus on the role of primary care in mediating the adverse impact of income inequality on health outcomes. Dr. Shi is also one of the developers of the Johns Hopkins Primary Care Assessment tools that have been widely used internationally to measure primary healthcare performance at the individual, practice, and system level. Dr. Shi is the author of 9 textbooks and over 170 scientific journals, and he has been named by Thomson Reuters in 2014 as among the top cited and therefore most influential scientists in the world in the area of social science. So with that, I will now turn things over to our guest presenter, Dr. Leiyu Shi. And Dr. Shi, I'm going to go ahead and pass those presenter privileges over to you.
Thank you so much, Sophie, for the introduction. And welcome, everyone. Today, I'm going to talk about our upcoming new 4th edition of the Essential of U.S. Healthcare System. Since my time is limited, I'm going to focus on highlights of this new textbook, as well as presenting some of the tips that we use in teaching this course using this textbook. So this slide shows that this is a condensed and simplified version of our longer Delivering Healthcare in America book, which was first published in 1998 and now in its 6th edition. This condensed book retains most of the key concepts and statistics from the lengthier Delivering Healthcare in America book. Those 2 books are published in alternate years so that contents are maintained fresh, and it is written in easy-to-read format, well-suited for junior college students taking a basic course in U.S. healthcare, or could also as a supplement to another course such as health policy. This book uses the systems framework to organize its materials. This slide shows the systems framework, which has 5 components, including system foundation, system resource, system process, system outcomes, and system outlook. All of the 14 chapters are included within those 5 components. I'm going to go over each of those chapters and highlighting the major components of those chapters. First, in Chapter 1, which is part of the system foundation component, we laid out the groundwork for healthcare delivery in the U.S. Here, 3 important things are covered: the major characteristics of U.S. healthcare delivery, the major healthcare system within the U.S., including various subcomponents such as managed care, system for vulnerable population, integrated care delivery, the public health system, and system for the military personnel. And finally, we also introduced 3 of the most dominant healthcare delivery models in the world, as represented by the Canadian model, the United Kingdom model, and the Germany model. Those 3 models capture the major healthcare delivery patterns in industrialized nations and offer comparison with that of the U.S. As you can see on the left-hand side, there was a cartoon underneath the chapter title. One of the exercises we do in this class is to have students do a competition. Each student is going to draw a cartoon summarizing the major contents of that chapter, and we will hold a competition at the end of the semester to see whose cartoon represents the most of the contents within that particular chapter. And then that cartoon will be used in the coming new editions. Now, Chapter 2 is a very critical chapter. It lays the foundation for U.S. healthcare delivery. Within this chapter, we focus on specific models related to understanding health and its determinants. Here, we define health determinants in a broad sense that includes not only medical, biological, but also behavior and social environmental. Also within this chapter, we contrast market justice and social justice principles. One of the exercises we use in getting through this concept is having students identify aspects within U.S. healthcare delivery that show this interaction and conflicts between market and social justice principles. Finally, in this chapter, we focus on both medical and non-medical strategies that improve health and addresses determinants of health issues. Chapter 3 is a historical overview of U.S. healthcare delivery. One of the exercises we do for this chapter is to have students present an evolutional perspective of the major current status within U.S. healthcare. For example, we look at healthcare reform and ask students to talk about the origin of those reforms. For example, we trace the beginning of Medicaid, Medicare, and Affordable Care Act. These three chapters form the foundation of the environment related to healthcare delivery. Then Chapter 4 through Chapter 6 look at health system resources. Chapter 4 focuses on human resources or healthcare workforce. Within this chapter, we not only present the major types of healthcare workforce, but also the challenges and issues related to healthcare workforce. Examples include access issue, cost issue, and use of non-physician providers and alternative medicine. One of the exercises we use for this class is to ask students commenting on how to address the provider shortage issue, other than increasing the volume of new providers. So we try to make students think about creative ways to address our healthcare delivery. Chapter 5 looks at non-human resources, specifically medical technology and its effects. Here again, we show not only various types of medical technology, but both positive and adverse effects of those technology. Chapter 6 looks at financial resources related to healthcare delivery. Here, the concept of health insurance is described, and various types of methods of reimbursing providers are highlighted. One of the exercises we do in this particular chapter is to have students critique different payment systems and various incentives associated with those. For example, in a fee-for-service environment, there could be no incentive and the cost could be escalating. On the other hand, with bundled payment systems such as DRG, the incentive is to reduce length of stay. And then, if using a full capitation system, the incentive could be on prevention and integrated care delivery. Chapter 7 through Chapter 11 look at the process of healthcare systems, or the continuum of care. First, Chapter 7 look at outpatient and primary care services. This chapter not only looks at various settings of outpatient care, but also emphasizes on primary care and its efficacy. One of the exercises we do is a case study on community health centers, its involvement, its role in serving vulnerable populations, and its role in the current healthcare reform era. Chapter 8 looks at hospitals. Again, here we not only look at different types of hospital, but also look at the role hospitals play in today's healthcare environment and how it can evolve further. Chapter 9 looks at managed care integrated care delivery system. This is a critical chapter as the U.S. healthcare delivery currently really focuses on managed care. So we try to distinguish the key features of managed care. By integrating payment with healthcare provision, managed care is able to contain cost. But whether it really achieves quality care remains to be debated. So one of the exercises we do is to have people look at different models of managed care and provide evidence whether those models achieve quality as well as cost containment. In terms of integrated care delivery, we really focus on the use of information systems to tie various components of healthcare together. Chapter 10 looks at post-hospital care, specifically long-term care services. One of our co-authors of this book wrote a textbook on long-term care and provided lots of case studies available to students in terms of looking at current settings of long-term care, issues, challenges, and future outlook. Chapter 11 looks at populations served, specifically those with specific health needs. We consider those vulnerable populations. Examples are racial ethnic minority population, women, those with mental health challenges, and those reside in rural communities. Then chapters 12 and 13 look at a very different component, which is system outcomes. In chapter 12, we focus on 3 critical issues in system outcome: cost, access, and quality. In terms of cost, we trace various reasons for the current healthcare cost escalation. Looking at access, we focus on different dimensions of access. And in terms of quality, we look at different current tools that measures quality. Chapter 13 relates to health policy. This is a critical chapter because tools related to health policy can be used to analyze and critique various aspects of healthcare delivery. The chapter is also important because students have an opportunity to see how health policy is formulated and implemented in this country. That knowledge is critical in helping understand the limitations and status quo of healthcare delivery in this country. The final chapter, chapter 14, looks at the future of healthcare delivery. This chapter really gears towards future models of healthcare delivery, towards integrated care that extends health services to the community, that integrates primary care with preventive care and medical care, that uses new technology not only to treat diseases such as in precision medicine, but also to facilitate healthcare delivery, such as mobile health, e-health, telemedicine, internet hospital, etc. Those examples are provided not only from the U.S. context, but also around the world. So this is a very quick summary of the highlights of those 14 chapters. One of the unique points of this textbook is that it has an updated coverage of the Affordable Care Act, or Obamacare. So if you want to do a case study of ACA, you can actually look at various chapters for materials. So what's new in this edition? There are three main things we highlight in this new edition. First, the new data and findings that happened in the last 4 or 5 years. Second, we summarize the main features of the Affordable Care Act and its current status. Thirdly, we provided numerous updates on various components within the healthcare system as reflected in each of the chapters. In addition to the textbook, the ancillary materials have all been updated. That includes the instructor's manual, PowerPoint presentation of the sessions, test bank, and also student companion website. How we might use this book for teaching? Well, if you teach a quarterly course or semester course, you can use this book as a primary book or as a supplement book. Here's an example. If you use this book to teach a 16-session course. So the first 7 sessions relates to introduction of the course material, foundation materials, as well as system resources, followed by midterm exam. And then the last 8 sessions look at system processes, outcomes, and outlook, followed by a final exam or presentation of a key paper for the course. The book can also be used to teach Obamacare or ACA. Specifically, materials within the book can be found that reflect aspects of the Affordable Care Act. This slide shows where those components are. So this is a very quick summary of this textbook. Now I'm happy to answer any questions that you may have in terms of this textbook, its contents, or how it might be taught. Thank you.
Thank you very much, Dr. Shi. That was an excellent presentation. And at this point, we will now open things up for questions. And just as a reminder, there's a couple of different ways to ask questions. You can either, if you want to vocally ask your question, you can do that. We have around 50 people on the line, and the way we do that is our operator, Latoya, is on the line, and she's going to manage all the questions, so you can certainly feel free to just go ahead and press *1. She will ask for your name and your institution name and queue you up for questions, so please feel free to ask your question out loud. Or if you prefer to type your question, you can use the chat box on the right-hand side or the Q&A box. I'll be myself monitoring both of those areas. So you can go ahead and type your question there at any time, and I will read your question aloud. So I do have a couple of questions I see coming through. Before I do that, Latoya, can I ask you to repeat those instructions for asking a question out loud? Latoya, do we still have you on the line?
If you would like to participate in the interactive question and answer session, please press *, then #1 on your telephone keypad. You will hear a tone acknowledging your request and a prompt to record your name. We'll pause for just a moment to compile the Q&A roster.
Great, thank you. And while you're paused, Latoya, I do have a question coming through on the chat box, Dr. Shi, for you. And the question is, U.S. healthcare costs are the highest in the world. What do you think are the major reasons for that?
That's a very important question. Indeed, U.S. healthcare costs exceed any other countries. I think there are many reasons, but three stand out. The first is the aging of the population. Within the U.S., we are seeing more and more elderly population. Why is elderly population an issue? If you look at the costs, those over 65 and over, they account for 14% of the population, but they spend over 30% of the healthcare resources. Second reason has to do with the growth of chronic diseases. In the U.S., a quarter of the population have one or more of the 5 major chronic conditions, such as diabetes, heart disease, asthma, hypertension, and mood disorders. Indeed, treatment of patients with chronic disease accounts for about 3/4 of all healthcare spending. Therefore, reducing impact of chronic illness is key to controlling healthcare costs. And finally, I think the reason is that related to inefficiencies in healthcare practices in this country. There are many, many statistics that I can cite, but just to let you know, 1/3 of our healthcare spending produce no improvement. In other words, they don't help improve health or relieve the health conditions. So those are the 3 primary reasons, I think, that account for high healthcare expenses in this country.
Great. Thank you, Dr. Shi. I have another question here on the Q&A, an excellent question about the use of the term vulnerable to describe racial and ethnic disparities in healthcare. And the question is, what is the rationale for using the word vulnerable versus other terms which describe the more realistic facts and disparities, such as underserved population?
Yes, I think underserved is also a proper term to use. Vulnerable is used because the concept of vulnerability reflects factors that individuals themselves have no control and that society needs to provide some assistance. Therefore, if you look at the vulnerability subpopulations, they typically include children, the elderly, those with chronic illnesses. Now, we do have racial ethnic minorities as a vulnerable population because many of their current health status is related to their prior precondition or predisposition. So therefore, vulnerability is used. Of course, I said earlier, other terms such as underserved populations can also be used as well.
Great. Thank you, Dr. Shi. And I'm actually getting quite a few questions coming through on the Q&A. A couple of people are asking the same question about availability, about everything. So I went ahead and advanced the slide here, and I'll just quickly point out, and we will go on to answer many other questions here, but the book itself is available next week, next Friday, and then the ancillary materials are going to be available following that. The instructor resources that Dr. Shi mentioned, such as the test bank, PowerPoints, and those items will be available, should be available in early to mid-December. Likewise, the student companion website and then the digital package, which I'll talk about later in the presentation, are going to be available in early 2016. So just to go back now to the chat box, or I'm sorry, the Q&A, I'm going to read out one more question here. I'm interested in hearing about the ACA and how that affects our current Medicare system.
That's a very good question. I think the ACA helps expand insurance coverage to more people, so hopefully it addresses one key aspect of access to care, the presence of health insurance. However, ACA does not guarantee that we have enough supply of physicians. Indeed, many times you see patients with insurance who cannot find a doctor. Many doctors do not accept new patients, for example. So the shortage of providers remain a critical challenge for this country. The other aspect of ACA is that it really does not truly address healthcare cost. So until and unless we fundamentally change how we provide health care, the way we provide health care, I think we will still have this challenging issue related to healthcare access and cost.
Great, thank you, Dr. Shi. And I actually have two more questions here that are almost the same question. One person is asking, I teach an accelerated 5-week undergraduate course in the healthcare delivery system to adult learners. How would you distill this book for a 5-week course?
Very good question. I sometimes also teach, people who have limited time. I think one way you can focus on introducing U.S. healthcare system is by looking at those insured and uninsured. So specifically, within the insured population, you look at managed care, publicly insured population, and then within the uninsured population, you look at the safety net providers, community health center, emergency room, public health clinics. So that way you could quickly introduce the healthcare system. And then the other thing I think a 5 or 3 week course you can do is really to look at the critical components of the system. For example, who are the providers, major providers of healthcare? And who are the what are the major types of insurances? And critical issues in healthcare delivery, such as cost, access, and quality. So let's say if you have, 5 days, one day might be an overview of the healthcare system, like I just described. Second day will be focusing on provider issue, the organizational issue, and the third day might be looking at various challenging things such as access, cost, and the quality issue. And the fourth and fifth day can be devoted to key aspects of interest to students that you want them to learn. For example, how do you use market and social justice to critique current status? How do you analyze the evolution of various healthcare reform developments? And how do you conduct policy analysis related to different aspects of healthcare delivery? So the first 3 days are content-rich, and the last 2 days can focus more on critique and analysis. So that's just one example I use to teach a short-term or workshop type of format.
Great, thank you, Dr. Shi. And we do have many more questions here in Q&A, which I'm going to get to them all. But before I move on to those, I'd just like to ask LaToya if you have any questions coming through on the line.
I'm showing no questions from the phone line.
Okay. All right. So just moving along here, Dr. Shi, we have a question about the textbook level. Is it appropriate for bachelor's or master's level instruction?
This is more related to bachelor's level. We actually use it at Hopkins for upper divisional undergraduate students, typically in their 3rd and 4th year, and to train them the idea of public health and healthcare delivery. And they are very good, source for them to get those knowledge. As for graduate school students, you probably need a more thorough and in-depth level book like our full-length Delivery Healthcare in America textbook.
Okay, great. Here's another question. Many people are confused about the U.S. healthcare system or how healthcare is delivered in the U.S. Is there an easy way to explain this?
Yes, as I said, many people, including those in the U.S., don't know how healthcare is delivered. So one way is to follow the insurance, people who are insured versus people who are uninsured, and then look at different ways healthcare is delivered by those insured, for example, under managed care, under integrated delivery system, for those with public insurance such as Medicaid. And then for the uninsured, we focus on, for example, safety net providers such as community health centers, public hospitals. So that's one way to clarify and organize the presentation of U.S. healthcare system.
Great, thank you. Here's another question. There is a severe shortage of healthcare providers such as doctors and nurses. What can we do about this?
Yes, as I said earlier in my presentation, that due to increase of the elderly population and increase of chronic illnesses, there's going to be higher demand for healthcare providers, but at the same time we have a shortage of healthcare workforce. So the way to do it, to me, is to fundamentally change the way we practice medicine. For example, right now we still rely on this physician-patient one-to-one interaction. Given the time physician has on a given day, it is conceivably very difficult for physicians to see all patients with needs. So one alternative is to focus on physician and his or her team, the healthcare team model, and rather than focus on one patient at a time, maybe we can look at certain patients as patient panels. For example, patients with chronic illnesses sometimes can be seen together by physician and his or her team. And in terms of physician team, it includes not only physician but also advanced nurses, healthcare behavior scientists, health educators, physical therapists, and so on, who have something to do with the care and the behavior and health status of individuals. So that's just one approach, that is to change the way we practice health. Okay, so
great, thanks. Okay. Here's another question. Could you discuss one feature of a foreign healthcare system, for example, Canada, that if implemented in the U.S. would likely lead to improvements in healthcare quality and patient satisfaction?
One important thing in Canada, for example, is how healthcare services are paid for. In Canada, as in other countries, the global budget system is used. What that means is each region or prefecture or province is given a budget to provide care to its population. So the incentive is going to be very clear. Rather than focusing on your own patients, patients seen by a doctor or a hospital, the idea is to focusing on all the population residing in the community. With that kind of payment system, the incentive is really going to focus on preventive care, health determinants, so that patients are treated at an earlier stage and risky behaviors are reduced. I think if we introduce that kind of payment system, such as global budget or capitation, such as which is used in HMOs under Kaiser, you would see a different kind of incentive. Rather than focusing on curative tertiary care, the emphasis will be on preventive and primary care and public health. So that's just one example.
Great, thank you. Another question, what do you think about using the doctor of pharmacy more as healthcare providers, since they are the most overeducated and underutilized healthcare provider?
That's a very good idea. Indeed, in some countries, pharmacists play a significant role in the healthcare of patients. For example, I was in Asia the last summer, and so many pharmacists actually interact with physicians in providing timely care, especially for patients with chronic illnesses. And some of the physician outputs, that is, they call it kiosk, is situated within the pharmacies, so that the patients going there can interact with physicians, who then interact with pharmacists to provide patients with timely medication. I do agree pharmacists should play a greater role in our healthcare system.
Okay, very good. What are the major objectives that a well-functioning healthcare system should accomplish?
I think a well-functioning healthcare system typically should accomplish 4 objectives. providing access to care, especially access to basic kind of healthcare services such as preventive care, primary care, and secondary care, and needed tertiary care. And then the second goal is to reduce cost or contain cost. That has to do with efficiency. The third goal is provide equity. In other words, people within the country should all have those access to basic care, regardless of gender, age, race, ethnicity, or geographical location, or socioeconomic status. And finally, enhancing quality of care is critical. That's why we are now focusing on patient-centered, safety, and effective, timely care. So those are the four goals I think any effective healthcare delivery system should strive to accomplish: access, cost, equity, and quality.
Great, thank you. We've got a bunch of questions, again, about the ancillary materials. One of the questions, Dr. Shi, with the depth of content in each chapter, has the test bank been updated with an equivalent depth of questions?
The test bank gives you examples of the kind of questions that you may use to ask your students. But in addition, I think you should focus on essay questions. We do have lots of essay questions to allow students to really use various concepts learned throughout the course, such as market and social justice principle, such as how healthcare is developed, evolved in the system, to analyze various status. So I would focus not only on the the quizzes and test banks, but also the essay questions.
Great. The rest of the questions are about availability of ancillary materials as well as the book. So at this point, what I'd like to do is just briefly remind everyone that the new 4th edition of Essentials of the U.S. Healthcare System will be available next November 20th, which is next Friday. And if you haven't already, please reserve your complimentary review copy, and you can do that by simply reaching out to me, and I can connect you with your account manager. I will provide my email address. Is actually right here. And in an email following this webinar, I'll also provide you with immediate access to the front matter, as well as 2 sample chapters that you can download right away. Those are available on our website. And then one other thing I'd like to bring to your attention is that Essentials of the U.S. Healthcare System, the new 4th edition, will include complimentary Navigate-2 Advantage access. And if you're not familiar with Navigate-2, this is a digital package that includes a comprehensive and interactive ebook, student practice activities and assessments, and those are both graded and ungraded activities and assessments, and a full suite of instructor resources and a learning and analytics reporting system. I strongly encourage you to visit www.jblnavigate.com/2. You can see some demo videos there. There are 4 videos that walk you through the various parts of Navigate-2 and how that works. And the package is available both for individual student use and also as a faculty-led course with the use of a course ID. This allows you to assign your students homework or any of the preloaded quizzes, tests, and exams within Navigate-2. All the assessments, activities, and content are preloaded in the Navigate-2 platform, and any graded assessments report directly into the gradebook. Oh, and by the way, Navigate-2 is fully compatible with Blackboard through the Blackboard Partner Cloud. So I encourage you to also reach out to your account manager if you'd like to, if you'd like a little bit more, if you want to get a personalized demo, we can do that for you. We have a great team of education technology consultants who can walk you through the entire product and how it works, and they can also help you get up and running for class once you're at that point. And while we have the printed book coming out early next week, the complimentary Navigate 2 digital package is on track to be ready by February 15. So for those of you who plan to use this text immediately in January, we're very pleased to provide a complimentary student companion website. Your students can simply redeem the access code card that's included with the book, and we will provide them with a link to get into the student companion website. And that companion website does include quizzes for each chapter, as well as flashcards and other exercises that are designed for independent study. And of course, if you're interested in reviewing Dr. Shi's other text, Delivering Healthcare in America, this one is currently in its 6th edition. This is the more comprehensive text that Dr. Shi referred to earlier in the presentation, and it's also very widely used. It's one of our top-selling titles, and it's also very current, having just published in 2014. This text also includes Navigate 2 Advantage Access, and that Navigate package is available immediately, and we're happy to give you a demo of that. And just to reiterate, just because of, I do see a bunch of questions, is that, the ancillary materials, the book is available next Friday. The ancillary materials will be available at some point in December, as well as the student companion website. And as I mentioned, you can simply reach out to me if you have further questions, and I will provide you that information. Well, thank you, everyone, very much for participating today and for your thoughtful questions. Dr. Shi, a very special thank you to you for your excellent presentation. I'm going to leave this slide up on screen so that you can make note of our email addresses. Dr. Shi has very kindly offered to answer your questions directly if you want to reach out to him at his email address. He'd be happy to answer your questions. So with that, I'm going to go ahead and ask LaToya to go ahead and close out the audio, and as I said, I'll leave this slide up on screen. Thank you again very much, everyone.
Thank you, everyone, for attending this webinar.